Nursing and midwifery vaginal discharges gynaecologyx. Vaginal discharges. Leukorrhea. This is an increased whitish mucoid discharge. The color varies depending on the cause. The discharge can be divided into vulval, vaginal, uterine. Vulval discharge is common in children and is due to dirt, threadworm, debility, or gonorrhea. Vaginal discharge is common in young and aged women due to anemia, constipation, or childbirth. Uterine discharge is common in the elderly women due to inflammatory conditions of the uterus or vagina, or it may be a result of malignant disease. Causes of vaginal discharge. 1. Foreign bodies. Foreign bodies commonly cause vaginal discharge, e.g. papers cut and placed in the vagina, causing infection in young pre-adolescent girls. For adults, forgotten menstrual tampons, IUD, this may cause odorous discharge. Bacterial infection. There are a number of bacteria causing vaginal discharge, particularly in the presence of trauma. The most common bacterial infection is Yersinia gonorrhea. Trichomonas vaginalis is the second commonest cause of leukorrhea. The infection is usually sexually transmitted. 3. Candidiasis. 4. Viruses like herpes virus hominis type 2, and this is sexually transmitted. 5. Cervicitis chronica associated with hypertrophy or endocervical mucosa may produce copious mucopurulent discharge. 1. Atrophic vulvovaginitis is common in premenarcheal girls and postmenopausal women due to lack of endogenous estrogen in production. 2. Carcinoma of the cervix. 3 other causes: pinworm, Entamoeba histolytica, Chlamydia trachomatis, Mycoplasma hominis, vaginal thrushmatotic or manilial vaginitis or candidiasis. Nursing and midwifery vaginal discharges gynaecologyx. This is a fungal infection with Candida albicans and is especially likely to occur in patients who have glycosureas and diabetics, in pregnancy due to low renal threshold for glucose, patients who use oral contraceptives, patients being treated with antibiotics. MBD infection is not usually transmitted sexually. Clinical presentations. There is intense vulval irritation and accompanying vaginal discharge, which is odorless. There is sometimes redness and inflammation of the vulval skin, which may spread to the thighs. With severe infection, the discharge is thick and white, and when it is removed, the vaginal wall is seen to be red and inflamed. Burning sensation around the vulva. Bleeding after coitus. Dyspareunia. Feeling of fullness of the vagina due to edema. MB. The fungus thrives well in acid media. Investigations. Wet preparations are taken for culture and gram-positive mycelia and spores are seen. Treatment. Nystatin pessaries 100,000 units inserted for 14 successive nights. Nystatin cream applied on the vulva. Nystatin tablets 500,000 units are taken twice daily orally to combat possible reinfection from the bowel. Other drugs include clotrimazole vaginal tablets, Canesten, amphotericine pessaries, fungalin and miconazole nitrate pessaries, gynodactyrin. Clotrimazole can be used in a dose of 500 ng. Treat the husband as well. Advice on personal hygiene. Complication. When not treated during pregnancy, can be passed to the baby during delivery, causing neonatal oral thrush. Trichomonas vaginalis greenish frothy yellow discharge. Nursing and midwifery vaginal discharges gynaecologyx. Minus cross-infection in antenatal and gynecological clinics may occur. Clinical presentation. 1. Onset is sudden, and there may be a history of previous similar attack. 2. It can occur in women of any age and is often seen during pregnancy. 1. There is usually a profuse, frothy, thin greenish-yellow discharge with offensive odor. 2. Itching, burning pain, and severe irritation of the vulva. 3. Inflamed vagina and vaginal portion of the cervix is red spots, strawberry spots on it, which makes examination difficult. 4. Occasionally blood-stained offensive discharge. 5. Dyspareunia, but unlike in manilia, these like coitus because it eases itching. 6. Insomnia at night due to itching and scratching. MB treatment is best during menstruation as the trichomonas flare up because the cervix is open and the infection move up and down. Investigations. HVS placed in a drop of normal saline covered with another slide and immediately taken to the laboratory without delay. Treatment. Metronidazole 200 TDS for 1 week. Alternatively, 2 doses of TOG may be given in 1 day followed by 1 daily for 7 days. Remen 2. Tinidazole in a single dose of TOG. Remen 3. Flagyl pessaries 2 not for 1 week. Remen 4. Avoid alcohol during treatment as it may cause headache and flushing. They advise patients on personal hygiene. Remen 6. Treat the husband as well. Phonococcal infection, purulent discharge. This is an infection caused by a gram-negative organism, which is kidney-shaped, called Neisseria gonorrhea. The Neisseria is inside the polymorph nuclear leukocytes, and they fight the leukocytes, which die and produce pus. The organisms may be found in the cervix, urethra, anal canal, or pharynx. The organism is rapidly killed by drying, sunlight, heat, and most disinfectants. The principal site of invasion is the genitourinary tract. Ways of transmission: spread by direct contact, usually coitus. Contact with infected articles such as pads, linen. Nursing and midwifery vaginal discharges gynaecologyx. 3. Pelvic pain. 4. There may be enlarged inguinal gland. 5. There may be edema of the vulva or Bartholin's abscess. The vulva, vagina, cervix, and urethra may be inflamed and may itch or burn. Investigations: 1. VDRL to exclude syphilis. 2. History of infection from the mother. 3. Clinical findings. 4. High vaginal smear which will reveal gram-negative organisms lying inside the pus cells. 5. Urethral smear may be taken. Treatment: for a pregnant woman, she should be given PP, F0.8 μl D for 5 days. Uncomplicated: 1. PPF 4.8 μl M with prognoscid 1 garli, or 2. Tetracycline 500 gr liquid for 5 days, or 3. Ampicillin 3.5 gr amoxicillin 3 garli with prognoscid. 4. Follow-up culture is obtained 3-7 days after completion of treatment. Failures are given: spectinomycin hydrochloride TWAG IM, disseminated infection. Oral ampicillin or amoxicillin or tetracycline is given as above but for 7 days. Other regimens are spectinomycin TWAG IMBD for 3 days or erythromycin 504 times daily for 7 days, or expen 5 mg daily IV until improvement occurs, then ampicillin 500 and given early kit to complete 7 days of therapy. Complications: 1. Blockage and narrowing of the tubes causing ectopic pregnancy and sterility. 2. Acute subingitis. 3. Nephritis. 4. Chronic cervicitis. 5. Bartholin's abscess. 6. Endometritis. 7. UD cystitis and urethritis. 8. Generalized pelvic infection, pelvic peritonitis. 9. Puerperal sepsis and puerperium. 10. Gonococcal eye infection in the newborn. 11. Arthritis, meningitis, endocarditis or rare complications. In the male: 1. Phimosis, epididymitis, urethritis, orchitis. 2. Urethral stricture. Nursing and midwifery vaginal discharges gynaecologyx. Signs and symptoms: the patient complains of a smelly, non-irritating greyish-white discharge, which may contain bubbles similar to those seen in trichomonal infection. Laboratory investigation: discharge is sent in steward transport medium for culture and sensitivity. Treatment: as for trichomonas vaginalis, new growths of the uterus, benign tumors, and cervix. Fibromyalgia are the commonest new growths of the uterus, and the most common are the fibroids. The growths are composed of mainly the plain/smooth muscles and fibrous tissues. They are particularly confined to the uterus, in which they may occur in great number and in varying sizes and weight. Fibroids do not arise before puberty or after menopause. It is commonly seen in women of 30, 50 years who have not borne children, and is most common in black women. Fibroids are associated with infertility, and one causes the other. Etiological factors: the development of myomas is clinically evident that it is related to the action of estrogen. They arise during the period of menstrual activity, although they rarely give rise to symptoms before the age of 25. They do not originate as a new formation once menstruation has ceased. Common sites and classifications: